Hi team. My submission for the hackathon is this project called Aegis. It's a clinical triage AI assistant. This app can be used by clinicians to report the symptoms which the patient has been reporting and then get a basic triage on how the patient needs to be handled. So if we see the app, the clinician can submit the symptoms that the patient reports, and once it is submitted, the Medcama model performs a couple of analysis, and finally we would get a clinical summary, a casual reasoning graph with the symptoms, and clinical reasoning as well. So the app would give us the severity classification, symptom extraction, clinical assessment, like we saw, so and so. So when we see the architecture of this project, so the clinician first types the symptoms in the UI, and from then we will be trying to use the Medgamma model that's being running in Kaggle right now, and the application is currently exposed to the internet via an ngrok tunnel. So we'll be trying to get the analysis via this path. In case if there is no internet, and if the clinician wants to get a offline result, we'll be switching to the edge AI layer, where we will be running a gamma model, and it uses a media pipe LLM inference, basically a web GPU, to do all the offline triage computation and give the final result basically. So let's see the demo. We gave a use case where we reported that a 55-year-old male has crushing chest pain, radiating to the left arm with diaphoresis, nausea, and shortness of breath. Once we submit this, the model performs view analysis, and finally we get a clinical summary telling what's the problem. It tells the patient has ACS. It could be due to factors like age, diabetes, hypertension. ECG should be taken immediately. So when we see the reasoning graph, it tells how each of the symptoms that being reported by the patient contributes to the severity, on why the model is classifying it as a high risk scenario. And if we see the clinical reasoning, we will have features that determine how it is being classified as a high risk scenario. In case of chest pain, it is given an importance of 85%. Similarly, for shortness of breath, nausea, diaphoresis, we have each and every importance. And when it comes to reasoning traces, we try to kind of show how we have made the observation and how the inference is made and how the evidence is found out by couple of clinical knowledge sources which we already have present within the system. And we also have a counter analysis tab, which basically tells if the symptoms that is being reported by the patient is slightly modified or is different, the severity will be modified differently. So this app can be used by clinicians to do online triage as well as offline triage